As of April 1st, you can expect more from your local pharmacist. Health specialist Leah Sarich here now explaining a new agreement between the province and pharmacists, which means you can spend more time with your pharmacist for free.
Yeah.
Which is fun.
Isn't that great?
Yeah.
It's wonderful. So this is a $55 million deal between the province and the pharmacists. And basically, what they're trying to do is sort of shift their focus. So the pharmacists are moving away from this idea of being pill pushers, per se, and to actually sort of patient-centered care. So they're sitting down with the patient, they're talking to them. I spoke with a pharmacist about this. She says it's this big shift, and it's about making the pharmacist an integral part of your medical team, and it's really about shifting to patient-centered care.
Anybody with diabetes and anybody who uses tobacco on a daily basis and wants to quit are now eligible to receive service from a pharmacist to develop a care plan and engage in follow-up to help manage both of those conditions. So yeah, you would sit down with a pharmacist or off to the side with a pharmacist who would spend some additional time making an assessment, developing what we call a care plan, which is understanding the context of your condition and your goals for managing it. Understand what medications you're using and make some decisions about different kinds of medications, and then work with you over a period of time with follow-up.
So you don't see that very often,
no,
actually sitting down with your pharmacist. Yeah, so that's the big shift. So as Stacey mentioned, this plan will now cover people with diabetes and people who are trying to quit smoking. But actually that's already been in place. This idea of the care plan has already been in place for people with high blood pressure and high cholesterol, where they often have many different kinds of medications, and they're on these medications for the rest of their lives.
What expanded services do pharmacists already provide?
Well, see, now this is a good time to revisit this, because I think a lot of people still don't realize that your pharmacist can actually renew some prescriptions.
Really?
Yes.
I actually had forgotten about that.
Exactly.
Okay.
They can even extend some refills as well. They can do that as well. They can even administer some injections. So these are things that people aren't often aware of. So your pharmacist can already do that for you.
Great.
Yes, in certain cases. But the real goal here is, of course, to reduce the impact on the healthcare system.
As our population ages and more people are diagnosed with chronic conditions like diabetes or like high blood pressure, more and more people need to access the healthcare system. So I think by positioning pharmacists as a neighborhood healthcare professional who can provide certain types of services to help you manage things like that, it enables more access for everyone.
This really seems to make sense, Leah.
Doesn't it make sense?
It really
It's
does.
really logical, right? Because these pharmacists, they know so much about their medications. And so what they can do now is take a look at you when you sit down with this and come up with this care plan, and they can manage your condition throughout your lifetime. And so they're looking at all the different interactions between those medications and how these medications are affecting you over the long term.
Yeah.
Because the basic thinking is, if you're preventing complications down the road from your chronic condition, then you're reducing the impact on the healthcare system.
Of course, you don't have to go to the hospital.
Exactly.
Yeah.
So think about it. If you've got high blood pressure and you're on several different medications, if you're managing your condition properly, then you're not going to the hospital for a heart attack, right, or something like that. If you've got diabetes and it's managed well, then you're not going to the hospital. You're not going to see your doctor as much. Everything is okay. And of course, that gives more access for everybody else when these people aren't in the system.
There you go.
So it makes a lot of sense.
It certainly does. All this is going to be
all
on
on my blog.
right?
Yep, a little later today, all on my blog. And of course, this all takes effect on Tuesday.
There you go. April 1st. Breakfasttelevision.ca. That's where you can find Leah's blog.
You
Around
bet.
the